Dr. Kelly, you and I have gone through a lot of school.
hmm
And do I use all the things I learned in school? Maybe like a 20% at best, you know? So I do think it's a means to an end. It's a necessary road that we do have to walk on, and yet it doesn't define us.
There's a sort of a thought out there that all doctors love school and we want to be in school forever. We are in school forever, but that's
Yeah.
not because we love it. It's because it's the path to where we want to get to, which is, helping people and treating kids and doing all of that.
Hello there. Welcome to the Good.Enough.Shrink podcast. We are your hosts. I am Jenna Chang, a child, adolescent, and adult psychiatrist practicing here in Los Angeles, California.
And I'm Dr. Patrick Kelly. I am also a child, adolescent, and adult psychiatrist practicing in the Los Angeles area.
We are on a mission to demystify child psychiatry and have conversations surrounding difficult topics on youth and adult mental health, but not without a little play along the way. Welcome back to the podcast. Today we have a topic that's been on our minds, I think, as the seasons change, and it's on school anxiety, school avoidance, and sometimes school refusal that can come on to children and adolescents. And so we wanted to really spend this time to talk about it at this current period because, I think a lot of kids are going through change in routine and the uncertainty of it all, of starting school again, feeling like, will I make new friends, or am I going to get the teacher that I want, or am I going to be in the same class with my friends that I worked so hard to make? We imagine this is a bit of a challenging time for kids, so we wanted to bring this up. In this context, we do have a lot of different things to talk about, but I think we want to focus on what can we do as parents, as providers, mental health professionals to help these kids reintegrate back into the school. So, just as kind of an introduction, Dr. Kelly, I wonder what you see when you talk to kids these days. But I'm seeing a lot of, with younger kids, separation anxiety, just being away from parents, family, the comfort of your own home, and getting back into this routine with unfamiliar faces. And then with older kids, there's a bit more of that, so many things have changed in my body and my friendships. Maybe there's drama that happened over the summer, and you just never know what your peers are going to think of you when you step onto campus. So, yeah, what have you seen?
Yeah, I sort of always joke that you couldn't pay me enough to go back to high school at this point,
Yeah.
let alone earlier schooling. I mean, just your whole world revolves around whether someone talks to you or sits next to you and everything. And that's not to diminish the perception. That's really how it feels in the moment, is that, you live and die by your reputation and by how you're doing in class and by what's happening in school. And I think that puts so much pressure and stress and import on things that maybe later in life, it's even hard for us as parents to look back and remember how critical that really was. And so I think it's easy for adults to diminish the subjective importance of all of these issues, but it's really important and it changes every year. I think the most stressful times or critical times are when somebody changes from, middle school to high school or changes from one school to another and kind of everything's new. And for some
Mhm.
people, that can be exciting, a new friend group, or you get to reinvent yourself. But for a lot of people, they don't even know how to get to the lunchroom, where the bathrooms are, let alone who their teachers are going to be. And there are so many unknowns that it can feel really scary. And I think you're right. For younger kids, the biggest unknown is what's going to happen to me, what's going to happen to my parents when I'm away from them for so long, when you're used to spending all of your time with those people.
Mhm. Yeah, totally. And I think one of the important concepts to help us adults understand where these kids are is the Erickson's psychosocial stages. So when I first learned about these stages, we talked briefly about them back a few episodes ago in one of the attachment series episodes. These stages, it's really kind of a framework. It helps us understand sort of where they're at. It's not a strictly categorical thing. It's not like this starts at this age and ends at this age, but it gives us a map of where your child might be. And so that's why I really like to share some of this. So Erickson came up with these stages of development that talked about a basic internal conflict within the child and then a certain virtue that they're striving towards. And there's 8 stages. And it starts with, infancy, 0 to 1 year olds. And the basic conflict here is that you have trust versus mistrust. Can you trust the world? Can you not? And the virtue that you're working towards is this hopefulness that you can, and that sometimes you have to be careful, but you can take a risk. So this is for basic things like nourishment and affection and protection.
One of the things that comes up about Ericksonian stages that people will talk about, I mean, especially if you happen to be taking your psychiatry boards, is what happens if you're not able to successfully navigate a given stage? What does that look like, and what sort of problems does that cause? So when we talk about Ericksonian stages, it's about getting through that and navigating that and hopefully successfully navigating that. But people talk about it in binary, you either do it or you don't. Whereas I think a lot of us can identify that some of these stages are going on at the same time at different ages in our life. And we can sort of look back and trace different things back to different stages. But they're really helpful benchmarks. And I promise you they will be on every test every
Yes,
medical student will take in
right.
psychiatry for the rest of their life.
Yes, yes. It's a perpetual reminder. Yes, exactly. Yeah, no, I think a lot of these things can be happening at the same time. And so after trust versus mistrust conflict, then you're looking at early childhood, 1 to 3 years old. You're looking at autonomy versus shame or doubt. So this is the way that we strive towards a will or wanting something. And so they start to develop a teeny, teeny bit of independence in small tasks, as the terrible twos, you start to like explore the world in an explosive way. So that's where this autonomy is starting to blossom. And then, you have a playful age of 3 to 6 years old. And this is more about initiating versus feeling guilty about it. Now, the words used here are kind of confusing, but I think essentially the idea is that you're taking an initiative rather than examining things that are handed to you, that fall into your lap. That when you take an initiative, it's vulnerable, it takes courage. And sometimes with that vulnerability, you feel guilty, like, oh, maybe because I took this initiative, something bad happened. And so there are boundaries that the child is trying to learn where they lie. And also, besides just whatever is coming to me, can I go and get something? So this is still kind of pre like school years, until 6 years old.
It's interesting that you use that word because it's preschool, right?
Oh, yeah,
Three to
right.
six. That's when kids are going to preschool. So a lot of
Exactly.
this independence and seeking things out can be nurtured in the right environment and helping kids be a little more free to try different things safely. And one of those things can be getting away from their parents and spending time with a group of kids without their big attachment security object. So I think a lot of parents see the separation anxiety idea, or at least the distancing and coming back and moving away, but looking back and making sure the parents are there. A lot of that will happen right around this age.
Hmm. Right. Then you move into the school age years, which is 7 to 11, 12, pre-adolescent, but definitely fully immersed in school. And this stage, you're actually grappling with the conflict of industry versus inferiority, which is a fancy term for competence. Am I good enough to be in school? Can I stay on top of my classwork? And can I make it? Can I make friends? Can I be socially competent? And so the self-confidence is starting to develop, not just to initiate exploring the world, but the belief that you are good enough is starting to develop. And so elementary school, 7 to 11's age range, the theme there is more so about can I make it? Can I make it through? And then the adolescent age is a little bit more about I've kind of made it, but do I belong here? Am I accepted? The conflict is identity versus confusion. The identity part is kind of more self-explanatory. You're starting to know what you like, what you don't like, where you belong, where you don't belong. And this is why, I think social media inevitably comes to mind because you are already at this very sensitive stage of experimenting and understanding and developing your identity. And then you have all this stimuli about what other people are doing. And then you inevitably compare yourself. I would not have survived if I was a teenager in this day and age. I think I would have, just a hermit life would have been okay.
Yeah, and I think it can be a confusing time for parents and for people around the adolescent too, because
Mhm.
a lot of adolescents will explore this and explore who they are by figuring out who they're not at the same time. And they'll almost try out different things or try on different identities, join different groups. And this is an overgeneralization, but one week they'll be a band person, then they'll be a sports person, then they'll be a TikTok person, then they'll be a mall person, then a hang out with their friends person. And it's normal for kids to sort of test and go back and forth on different things. So I think parents say, oh, this is just a phase in a way that dismisses this is really important to the kid and they're really trying it out. They really want to see if this fits. Now, factually, it may be something that is there for a period of time and then gone the next. But when an adolescent is in it, that's their passion. That's what they're all about, and they dive in deep before they maybe move on to the next thing. So I think supporting both the identity that they're forming and the fact that it's going to be flexible and that they're not stuck there is a hard job for for parents and for people around. But that's what this phase of life is all about.
Hmm. Exactly. It's like going with the wind wherever it takes you. It's very disorienting, but also necessary.
Mhm.
Yeah, and I think maybe just we'll briefly mention the early adulthood because it also relates to college years. This is between around 19 to 29 years old, and you're kind of now steering away from that identity self-preservation kind of view, and you're looking out into the world for relationships. And of course, people have very, very important intimate relationships in high school too. So again, this is not strictly bound to these years. But the basic conflict here in 19 to 29 years of age is intimacy versus isolation. So this is when a lot of people find that one secure attachment figure, if they haven't had it, growing up, or maybe they understand the benefits of this intimate, unspoken understanding from another person, that really can give you a sense of belonging that gives you a lot of security. So when kids go off to college, you're going away from family, parents, and then you are inevitably looking for that intimacy. And if you don't find it, you might lean more into isolation, which then will make going to school extremely difficult. I think a lot of times we do want to go to school for academic passion or interest and things like that, but to have a community or at least one person that understands where you're coming from is like night and day.
Yeah, I think so too. I think it's and you're right. It doesn't have to just be romantic
Mhm.
relationships. It can be best friends, friend groups. It's sort of the idea that you know something more about who you are and what you like, but it's about figuring out how that relates to others and to the greater world and sort of who you are in those relationships. And I think a lot of people would look back at those years of their life and think that that's when they met kind of their core group of friends. That's when they really solidified that and sort of established that. And people are always flexible. But I think that's a real point of growth and rerouting yourself in something new and something different.
Mhm.
And we're giving ages here, and that's what would be the typical answer on the test. But I think there are people who start that earlier, especially if they have be less of a secure attachment already. They're sort of really looking for that. And so they might start establishing this phase and trying to join a group at a younger age. Some people started later. They take more time to figure themselves out before they start jumping into relationships and jumping into other things.
Mhm. Right. Yeah, it's a very personal journey. So, in terms of statistics, how common is this issue with school and refusing to go to school? So, it's quite common.
Mhm.
Up to 15% of children have clinically significant symptoms that lead to school refusal, which I do firmly believe is an understatement.
Right. Yeah. And a lot of these studies are from clinical populations. So when people do studies, there are all sorts of differences in how they're designed, but a lot of these studies came from patients who were already in care, who were maybe matched and standardized, but people who already rose to the level that they were having something significant happening to them. I think if you surveyed a general population of kids in school or going to school, and it's also about how you define clinical significance. But I think if you look at who's having anxiety over returning to school or starting school, I mean, over 50%, I would say. I think this is
Right.
very common.
Yeah, and to think about that transition of not too much structure, waking up a little bit later into a much more structured environment is uncomfortable for, I think everyone. But how do you tell if your child is having anxiety about school? And specifically, I think we're talking about anxiety clinically, that it is noticeable and it's something that needs some level of intervention.
Yeah,
And
it would be
so,
great if every kid just said, "I'm anxious over going to
right,
school." But
right.
that would make our jobs easy. But I think
Yes,
we have to be, as parents do, we have to be detectives and get to know our kids. So there can be
right.
more subtle signs.
Yes, we do not have enlightened children,
Yeah.
unfortunately. It's just like that. So one of the first signs is, of course, more tantrums, more irritability and mood swings. Didn't get the cookie he wanted and like they snap just like that. Or avoidance of activities, actually not just about school or in school, but also outside of it. There's some sense of I can't face school, so I might as well not face anything. Let's just sit at home and not do anything. And then I do think this is really important that the physical symptoms really start to come out. I think a lot of times kids are not able to express themselves, articulate themselves, or even like want to say anything about how they feel about school. And so they would have stomach aches, headaches, fatigue, difficulty sleeping. And it is important to conceptualize these physical manifestations of anxiety as not that they're faking it and trying to get what they want, but there is a functional aspect to it that this helps them in some way. I think we use that term functional to really emphasize that it's a protective mechanism, that there's something really difficult, challenging going on, and there's no way to verbalize it. And so it comes out in your body as your body keeps the score. So, yeah, I think calling this a functional symptom is important to highlight. And then, of course, changes in eating and sleeping as well, those show up too. So, why does this happen? Why do children refuse to go to school? And there's a number of reasons.
So there's a psychologist, Christopher Kearney, at the University of Nevada, Las Vegas, who's one of the world leaders in thinking about this. And he introduced the model of the four functions of school avoidance as a way to try to understand why this might be happening, because it's frustrating. And I think people have different notions over what might be leading to this anxiety, leading to a kid to not want to go to school, to avoid school. And frankly, a lot of times it comes from us and our assumptions and sort of seeing the kid through our eyes, as opposed to really stepping back and seeing from their eyes what is happening and what could be getting in the way so much. So he proposed four ways to see school avoidance. The first two are somewhat similar, so we might spend a little bit more time on that. But the first one, and I don't think in any particular order, it's just the way that he put them together and framed them. But the first one is to avoid negative internal feelings from the school environment as a whole, which itself provokes anxiety or depression. So his idea is that some people, just like some people are afraid of flying, and some people are afraid of heights, some people are afraid of school. Some people feel sad or anxious about school itself.
Mhm.
And why that is and where that's coming from could be very important. And teasing that apart sometimes will land you in kind of the second function, frankly. And we'll get there. But the first function is really more about school. School is the bad word. School is what gets in the way and is terrifying. And so it's such a big concept and it's so hard to put your finger on. And kids actually feel that too. So a lot of kids will have trouble saying or explaining exactly what's happening. So sometimes if they're not able to really put their finger on what it is about school, then this is where you are, that it's just the concept of school itself. And a lot of times this will come out in those sorts of physical symptoms because
Mhm.
your anxiety, it can't come out verbally. Sometimes it can't even come out cognitively. People don't really know. So it'll come out physically. So people will have stomach aches, headaches, nausea, muscle aches, tension, they can't sleep. So you'll get a lot of other things that come up that point to school is creating all of these negative feelings, all of these negative emotions. And by avoiding school, I can avoid those negative feelings and negative emotions.
Mm. It's almost like classical conditioning in a way.
Mm-hmm.
Like it's like school, and then it's like, the dog salivates, but school is like stomach hurts.
Yep.
You hear that word and you see that word, you get an email about it or something, and it's like automatic. So that definitely can be so closely associated to this negative feeling. And it sounds like also just the second point that he was making was that school avoidance allows you to escape aversive triggers. And especially, I struggle quite a bit with helping kids with bullying because there are so many different ways that kids get bullied. And I realize how vast that term can be. There's like that subtle gaslighting looks of discontent and dissatisfaction. And then there's also just straight up like they're throwing rocks at you. So, I think it's just, yeah, if you're having that kind of experience, why would you go to school? It doesn't
Right.
make sense.
Yep, totally. And I think that's what is at first reading what makes Kearney's way of teasing these apart a little bit difficult because I think in a way, sort of the first function and the second function can bleed into each other because if someone goes to school and they're constantly put down and they feel like they don't belong because of it could just be something that's about them over which they have no control. It could be their race, it could be their gender, it could be that they're in the wrong group, or it could be something else. But every day you go and it's so negative, then that can turn into every time you hear the word school, you just curl up into a ball. But his point of teasing this apart is that there's a specific cause. There's one thing that happens to happen within the school that is making the person so afraid or scared or anxious. And if you sort of address that thing, then the anxiety around school can lighten. So I think his point in trying to separate these two is really about how and where you intervene. And we'll talk about treatment later. But I think for the second part, where there's a specific trigger or a specific stimulus, you address the trigger and the stimulus, right? Like
Mhm.
you can't stop school, right? Many people
Mhm.
would like to, but you can't do that for the first group where school itself is scary. But
Yeah.
for the second one, if it's bullying, there are ways to address bullying. If it's social phobia, there are specific treatments for social phobia. If it's, we saw this a lot during COVID, unfortunately, that where people would have high anxiety or health anxiety or OCD over getting sick, being in large crowds, being around big groups, being in a classroom. They wouldn't touch their desks, they wouldn't touch their book bag. And that was really a specific thing that happened to be happening in the setting of school. Or, I've certainly seen people where maybe they have a specific learning disorder that goes
Mhm.
unidentified. And so they just can't get on top of math or English. And so it's a specific thing which is addressable and treatable, but can generalize to school. It's kind of a complicated topic to try to pull those two apart. And I think that's why we're spending a little bit of time about it. But broad strokes, one is much more general, one's much more specific. We'll talk more about those, but the third function of school avoidance can be more tied to the idea of separation anxiety. It can be to get closeness or attention or spend time with your attachment objects. So you really don't want to go to school because you don't want to leave your house and you don't want to get away from your parents and you don't want to go into a foreign environment. You want to stay with what's close and what's safe and what's around you. And by staying home from school, you get to do that. You get to stay with the system you're in. I think this is one of the when we talk about behavioral treatment, this is one of the most behavioral approaches because it's all about setting up both the kid and the system, including the family, to sort of move things in a different direction where school becomes positively rewarding and reinforcing and sort of taking that chance of going to school. But that's really the underlying problem is that it's not school. It could be a baseball game. It could be camp. It could be
Mhm.
anything. It's about leaving something and going to something else. It's not so much that school itself is the problem or the scary thing. And then
Mhm.
the fourth function of school avoidance is what in the olden days and what to an extent still today would really be called truancy. It's sort of the option to not go to school because there's simply better things to do with your time. That I don't want to go to school because I'd rather be hanging out with my friends. I'd rather be playing video games. I'd rather be doing XYZ. It's not that school is scary or school is aversive or school makes me feel sad. It's simply that other things are more pleasurable. So I'm not avoiding school so much as I'm choosing to do something that's more fun and more enjoyable. And it's really a choice. I think why this is super important to have here in this discussion from the outside, many people overly attribute school avoidance to this. I think many people think that 75-80% of kids who don't go to school are just truant. They're just lazy.
Mm.
They want to play video games. They want to stay home. They choose not to do it. When really that's not true. That is there, but I think it's a much smaller percentage. And I think it's worth having it in the world of consideration so that we can look at it and really see how low it actually is and how much more common it is to have these other things and these other reasons that are coming up for a given person or a given kid.
Exactly. It reminds me of, especially in the older kids, that, if you can start to work and make pocket money from your job at Subway, for example, and school isn't giving you anything immediately rewarding, you just have to go because, like, illegal not to go, but your part-time job is giving you money, which you can save and maybe get a car or something like that. Yeah, so it's important to consider like where that person is in terms of what's prioritized and what's important to them. And it helps us ask the question, what's really going on here? What do you want? What are your goals? And it just opens up the conversation instead of just shutting them down as lazy,
Mm-hmm.
or, the kid that sells drugs. But, selling drugs makes money. And so what is the goal there? What would you like in your future and in your life? And so the perspective taking and opens up the conversation about what's really happening.
Mm-hmm.
So, we do want to give some practical tips about how to make this transition easier. First and foremost is the one answer nobody really wants to hear, which is prepare early.
It's what adults
And
don't want to do. It's what the kid doesn't want to do. It's what no one wants to do, but it
nobody.
works.
Yeah. And it's so worth it. I think if your school starts in mid-August, start thinking about it in July. If it starts in September, start thinking about it in August. Adjust that bedtime. My goodness, that bedtime is so hard. Once you start sleeping around midnight, 1, 2 a.m., it's not going to change in a week. It's not going to happen. It's going to be a few weeks. And so adjusting it as close as you can and also as steadily as you can. I often tell parents don't go from like 1 a.m. to like 10 p.m. It just doesn't work. 1 a.m., 12:30, 12, 11:30, just increments, manageable increments, feasible increments. And waking up, certainly some kids are early risers, some kids are night owls, and we still have to put them into this cookie cutter mold for school. And so to validate their experience, if they are night owls, that this is going to suck and it's going to be hard, but it's really, really important that you have energy to survive the day. Sometimes kids, I think adolescents particularly, like some sort of morning routine. There's actually like a lot of videos out there on YouTube and things about this, making it very calming and this romanticizing this morning quiet hour where you don't have that email come in just yet. And then just kind of very actionable things like visit the school. What's the route going to be? Are you going to get a ride? Are you going to ride the bus? Going through the motion together.
Yeah, I
Um,
think more predictability and more routine is really the rule. Kids don't, they may say they do, but they really don't like not knowing what's going to
Hmm.
happen. And even though it's time out of your weekend, it's time out of your Saturday, who wants to think about school now? I'm going to be spending plenty of time there in the future. Just practicing, getting your backpack set up a few days beforehand, driving by the school so you see the physical footprint, knowing the route, knowing how long it's going to take, or walking with your parents to the bus stop if that's how you get to school, and sort of waiting there and walking back and really trying it out and getting that muscle memory going, and it's so funny because I'm sure you have the same experience, but you start having this conversation in the office and everybody looks at you like you're telling them to go on a diet. They all have the same look of, I really don't want to hear this, the kids and the parents.
Right.
But yeah, same thing goes for the weekends. If bedtime's 9 o'clock, it would be great if you could have the same bedtime and even the same morning routine on the weekends as you do during the week, because then it doesn't shift, it doesn't get out of balance, and no one wants to hear it. But
Hmm.
we have a ton of evidence that it's what works.
Yep. And if you have a day where just nothing is working and you just had enough and you have to, sleep in or something like that, and there's frustration being built because now you're like a step behind, it is very, very also important to talk about your feelings. So, acknowledge that there is anxiety, that school anxiety is a very real thing that I would imagine all of us adults have had at some point in our lives. And so, with that comes not so much interrupting them or giving them advice, but to actually just reflect back to them. And so, if they're saying, I hate school because I just hate the kids there, then you just reflect. You hate the kids there. Tell me more. Or help me understand. What do you not like about them? What's going on there? Oh, they make you feel like you're weird. Oh, do you believe that? Like, what do you feel when they look at you like that? So, kind of just letting them lead the conversation. Sometimes I've asked parents to, as your child is talking, just think of like a synopsis of their story, like a plot. You just imagining in your head, okay, this is where they're going and this is what's happening. And as you're thinking about this plot for your child or synopsis, you are not trying to put your thoughts and tips and advice into their story, but you're just absorbing their story and reflecting it back to them. So there's a lot of power in reflection and asking back to them, because it tells them now, as they're going through this competence stage, like, am I competent enough? Am I good enough? Are people going to like me? You're giving them back the sense that what they feel and think matters, that it's important, and that you're here.
And it can be hard. I think all of us want to help someone feel better when they say something like that. And so, all the kids make me feel weird. You're not weird. Why would they say that? They're so mean. And that makes us feel better and makes us
Mhm.
feel like we're being supportive. But in the wrong context, that can almost come across as how you perceive it is wrong,
Mhm.
and it can be invalidating in the weird way. And all of us just want
Mhm.
to feel like what we think matters, even if it's not, necessarily 100% factually accurate. It's 100% our feeling, and that is neither accurate nor inaccurate. It's how you're feeling, and to have that just
Mhm.
sort of heard and understood and reflected back can itself be very powerful, especially for someone who's learning what feelings are and what words you use to describe them.
Exactly. Yeah, exactly. That subjective experience and sharing that subjective experience, the intersubjectivity we've talked about a little bit before, is so, so important. It's like I can't even emphasize enough what that does for the child in the long term. But you're right. Like there's almost this like reflex to say, you're
Mhm.
not weird. No, you're okay. And yet like holding that for them empowers them.
Yeah.
So, if there is emotional dysregulation, however, which can come, freaking out, panic attacks, and so on, you can teach them coping skills. And I think it's really important to have a therapist or somebody that you can trust, the child can trust, that feels comfortable with, to really reinforce these. And so, deep breathing, mindfulness, which is anything really that takes away your full concentration and you can be very present. There's also something called progressive muscle relaxation, which is contracting and releasing your muscles one section at a time to just ground yourself in your body. And then this might be something people have heard of, but the five senses, five things you can see, four things you can hear, three things you can smell, two things you can feel, and then one thing you can taste. Again, even going through that, I'm like trying to concentrate, like, okay, what are the senses? So it helps you be very mindful and grounded.
And this is
So
a lot of what we do in the office. That's a really good point that, having somebody, a coach even, who can sort of take someone through this and then they can learn it and practice it because it is something that the more you do, the easier it gets and the more likely you are to do it. That said, just like the morning routine, there are YouTube's apps, there are kid-friendly things that can be really helpful if you or your kid has an interest in learning some of these independently. I don't want the message to be that seeing a therapist can be a barrier to learning some of these things, which
right.
you can do on your own.
Right, exactly. Yeah. And so, as you can imagine, this takes a lot out of the parent to be attuned to their emotional states and support them, but also give them boundaries, structure within which they can flourish. It is hard, but you do want to, as a parent, model the behavior that you'd like to see in your children. And so, I think it's very, very normal to feel frustrated with how they don't want to go to school, but to model that calm demeanor and understand that it's not a lack of will, but it's a lack of skill. This is actually by Ross Green, who came up with the collaborative problem solving approach to oppositional defiant conduct disorder kids. So that's kind of on the side of the child and the parent at home, how we can mitigate some of these difficulties. But on the school side, there is also a lot of things we can do. So there is something called the 504 plan or the Individualized Educational Program, IEP program that exists in the schools. And some parents are very well aware of this. But if your child is struggling academically, you can submit a written request for accommodations at school. And there's actually a website, and I will put this in the show notes, but there's a template letter that you can just put in your child's date of birth and name and print it out and submit it or email it to your principal, to school principal or a special education coordinator. And from that date on, the school, they do have 30 calendar days to schedule an IEP meeting with you and whoever you want involved. So you could include your child's therapist or tutor to come to these meetings as well. Of course, schools are doing their best, but there might be also things that you can do in terms of extending deadlines or flexibility and, the timeline of turning in homework that can really make or break a child's confidence in themselves.
Yeah, I think the idea of school accommodations, educational accommodations is a whole world. And it's really hard, especially if you're trying to figure it out yourself for the first time. Um, Almost all child therapists who I know about and child psychiatrists are whether we want to be or not, pretty expert at this process by this point.
Yeah.
There are also professional educational advocates, there are attorneys who really know this, and there are a number of dedicated information sites, websites that we'll put in the school notes if this is something that has come up or if you're interested in learning more about. I think it can be extremely helpful for kids with school avoidance, with school refusal. That is honestly one of the, I think, smaller or lesser known elements of the 504 plan and IEP. It's a whole big system that is mandated by law to make sure that every kid gets appropriate education. That's the wording of the law. So if you feel like for whatever reason your kid is not getting that, it's absolutely something that's worth considering, worth looking into, and worth talking to a professional about.
Right. And after we've done all that we can from individual and family and school perspective, and there's still huge challenges going to school, then we do want to talk about when to seek psychiatric helps. We look for warning signs, specifically for isolated behaviors, being withdrawn, staying in the room all day, and not talking, especially for a child who's typically more interactive, or maybe having excessive panic attacks daily or a few times a week. That's drastically different from before. You're having trouble breathing, you just feel this intense sense of doom and anxiety. And constant negative self-talk. So they may say things like, I hate myself, or I'm stupid, or I'm ugly, or something like that, where they're constantly repeating. And that can seep into the realm of, I'm not good enough to live and I don't deserve to live. And then suicidal and self-harming thoughts can be expressed. And so that's definitely, most definitely, a time to seek psychiatric professional help. There's also things like drugs and alcohol. There's a certain level of escapism with those substances. And when school is intolerable and nothing is working, you want to escape. That's normal. And so you might be turning to things like weed, vapes. Vapes are such a huge thing nowadays, alcohol. And of course, declining academic performance grades, you're failing everything. All of these warning signs can be of different duration and severity at different times. And so just because it sort of happened one time and then it disappeared, doesn't mean that that was kind of like totally solved, on its own. So we do want to kind of keep that conversation going, and that it's really something they can get a lot of help for.
Yeah, that's one of the ways I like to think about it. I'm glad you brought that up. When people ask me, when should I think about seeing a therapist, think about seeing a psychiatrist, and the two things I generally think about, well, three things are severity. If something is very severe very quickly, or duration. If something started and just keeps going on without seeming to resolve or seeming to improve, and change. So if things are relatively recent, they're not super severe in the global standpoint, but someone goes from, say, a straight A student to a C student, which is not terrible, but for the person is a huge change. Any of those three things, if those are coming up, I think it's worthwhile to see somebody and at least get a second set of eyes on what's actually happening and get a formal evaluation, get a second opinion from a therapist, from a psychiatrist, even if it's just from your pediatrician, someone that you're seeing anyway, that you're already connected with, who already knows your child. I absolutely always think it's worth it.
Mhm. And so when you come see one of us or a psychiatrist, there is not a one size fits all treatment for school anxiety and refusal. You really have to combine all of the things that we already talked about on the individual level, the family level, and the school level. But if it does come down to specific types of therapies, we do find that cognitive behavioral therapy is quite helpful. You're addressing these negative expectations and thought patterns about school and triggers at school, and you're developing coping skills in response to that. I do think that CBT in these kind of more urgent times, because school, like, once you miss like a day or two or a week, you just keep falling behind. And so there's a big sense of urgency. I think CBT is helpful because you're just immediately learning coping skills. And of course, parent management training is another really, really important part, because as your child is tolerating this distress, to watch that, to sit there and almost like let them suffer through, to know that there's a light at the end of the tunnel, but for them to experience this distress and then come out of it is so heartbreaking for parents. And so whether it's parent management training or family therapy to work on that separation, the healthy separation and individuation and autonomy building, can also be extremely helpful from a therapeutic standpoint. In terms of medications, we as child psychiatrists, we are quite mindful of how most of our kids have never been on medications. And so we always want to be intentional and careful about what we use. So I do think typically you want to know, is this something that the child is suffering so much from that the child needs a daily medication? Or if something that's a rescue medication, that in the moment when you're having a panic attack, you take a medicine to help you calm down and then gather your thoughts, and that's good enough. So that's where I think we would start.
Yeah, I completely agree. I think the idea of medication can be both tremendously helpful and tremendously scary in and of itself, right? For
Mhm.
parents, for kids, I think there's an idea that, gosh, am I really sick enough or bad off enough to need medication? And that's not how we think about it, but I think that message sometimes comes across. If there are factors that may be separate from the school anxiety that are coming out through school anxiety. So if someone has depression, if someone has panic disorder or panic attacks, and it's coming out through the lens of seeing it in school, then they deserve to feel the best they can. And they deserve to have that sort of underlying thing treated, right? Like if somebody has some sort of medical illness and it comes out like a fever, you
Mhm.
can give them Tylenol or you can tell them how to take a cool bath. But until you help what's actually causing it in the first place, it's not going to get all that much better. And so that's how I think of the view of medications for school avoidance or school anxiety. If something else is happening that's causing the school avoidance or anxiety, you treat it just like you would in any other situation. If it's more isolated, then generally it's a conversation with the parents, the therapist, with the child about the risks and benefits of thinking about medication, using medication. Some people will prefer to do therapy first, even if it has gotten to a relatively extreme stance, just because the idea of medication doesn't sit well. Other people will say, I want the full court press. I just want my child to feel as good as they can feel as quickly as possible. I want this to get better. And if there's a tool in the toolkit that can help with that, let's talk about it. Most people are somewhere in the middle, right? How significant has this problem gotten? Are they missing so much school that it's going to be harder and harder for them to catch up? Or is this starting to generalize where it started with they're worried about going to school and now they can't leave the house. Now they can't sleep at night. Now it just it's progressing and we want to get ahead of it and we want to get in front of it, or the panic attacks are so distressing for everyone, they're throwing up all the time, now they can't eat food anymore, then we need to use something to get in front of it. So it's like school avoidance itself. I don't think there's a one size fits all approach, which is why it's important to find someone that you can have these discussions with, but that's
Mhm.
my general approach to it.
Yeah, knowing is there more to this than just the school. That's a huge part of the psychiatric assessment. Yeah, and so if it happens to be that you are interested in medications, briefly we can talk about some of these specific medications. And I
Mhm.
do want to preface this by saying, please consult your own psychiatric provider, and just these are general recommendations, and we would hope that it gives you some guidance, but that it's really important to talk to someone that you trust, a provider, and build your own treatment plan. So, having said that, now serotonin reuptake inhibitors, SSRIs, are kind of our go to for depression, anxiety in children and adolescents. These are medications like fluoxetine or Prozac, Lexapro, escitalopram, Zoloft, sertraline. So you may have heard of these medications, but they do take a while to really kick in. Sometimes you might experience some benefit in the first couple of weeks, but it does take, a month or two to really settle in. And so it takes quite a bit of patience, which then we do have to talk to the child about adjusting our expectations for these medications.
And those
Medica
are medications that you take every day that work slowly over time. They even if they take time to work, it's not, oh well, I'm having a particularly bad day, I'll take two, and today's going to be a pretty good day, I don't need it at all. It is something that sort of evens out over those months, and you start it and stay on it for as long as it continues to be helpful.
Exactly. And there are medications that you can take as needed for anxiety and panic attacks. And we generally try to avoid benzodiazepines as much as possible because they are habit forming. They can cause excessive sedation, should not be mixed with alcohol. It can also cause disorientation and falls. And there's a lot of risks with benzos. So things like Xanax, Klonopin, Valium. And so we avoid them as much as we can and instead turn to medications like hydroxyzine, which is kind of like Benadryl, but is specifically more targeted towards anxiety. Also use propranolol, which is actually a blood pressure medicine, but it works really well for anxiety and is specifically performance anxiety. Buspirone, another medication FDA approved for generalized anxiety, and then gabapentin sometimes, especially anxiety that may manifest as aches and pains as well. So it can be overwhelming to hear these names, but there's a lot of options, and it doesn't have to be, you need a Xanax. There's a lot of options even outside of the medications I mentioned, and so the hope is that we give you some sense of hope that there's a
Yeah.
lot of options.
Yeah, and I think that you're right. There are some misconceptions around that. So, just to be clear, going to a psychiatrist does not mean your child is walking out of the office with a prescription or with a
Right.
medication. In fact, I think that's more rarely the case
Mhm.
than anything else, especially after the first meeting. It's more about figuring out what's going on, getting a good diagnosis, and putting together a treatment plan, which may or may not, and usually does not, especially that first time, include medicine.
Mhm.
Um, the other thing is that no one's going to force medication on your child in these settings. You're still the decision maker. You still get to say what's right or what's wrong. So even going into the office, I've had plenty of people who say, once they come in, it took me so long to schedule this appointment because I really didn't think they needed medication.
Mhm.
And part of me just thinks, oh, I wish you'd come in sooner because that's fine.
Mhm.
We can talk
Mhm.
about everything but medication if that's what you're interested in, if that's what's going to be most helpful.
Mhm.
That it's not a commitment to do anything.
Right. That is so true. What a lot of us, I think especially in child psychiatry, it's like everything else besides medication. Like you really have to pick apart and understand. And part of why I love it, there's just no magic pill. And so to let people know that, we are not a pill mill. We
Hmm.
don't, that's not what we're doing. We just want to really lay it out and be able to absorb different complexities that are happening to your child. And I think nowadays, especially seeing a psychiatrist and particularly a child psychiatrist, really difficult. There is not enough of us. So if there's any listeners out there who's considering child psychiatry, please reach out. We
Yeah.
would love to recruit as many people as possible. So, in terms of resources, the American Academy of Child and Adolescent Psychiatry has these little fact sheets for families. And there's actually a whole section on school related things, whether it's starting school or school refusal or a special education services. And I will put that in our description and show notes as well. And then there is another organization that I found, the schoolavoidance.org, and it puts together all of these different stories from people who have had struggles with schools and just one place to access a lot of that information. So I think, leaning into the digital world of information, especially when it comes to something like school, which is you need specific concrete tips, is quite helpful.
Yeah, the more we talk about this, the more I think about other things we could be talking about in this same space. I mean, this could be a whole podcast by itself, not an
Yes.
episode.
Right.
Just sort of going through specific instances. So, if people have questions, want to hear more about this or any particular part of this, reach out. I think part of why we go into child psychiatry and what we like about it is helping to educate people about the school system and the school process because we get a crash course and I knew nothing about this before going into the field. And it's such an integral part of my previous life that I've just forgotten about and didn't know anything about.
Yeah, and what I might say about school is, Dr. Kelly, you and I have gone through a lot of school.
Hmm.
And do I use all the things I learned in school? Maybe like a 20% at best, you know? And so I do think it's a means to an end. It's a necessary road that we do have to walk on. And yet it doesn't define us. If I based my career success on how I did in early school years, it just wouldn't match. So I think school teaches you how to follow instructions, responsibility, accountability, and some level of discipline and structure. But I think at the end of the day, it's really about your child and knowing and understanding what's important to them. And so school is important, but your child is more important.
Absolutely. Could not have said it better myself. I think there's a sort of a thought out there that all doctors love school and we want to be in school forever. We are in school forever, but that's
Yeah.
not because we love it. It's because it's the path to where we want to get to, which is, helping people and treating kids and doing all of that. And
Mhm.
I think one thing that you learn going through intense schooling is everybody figures out their own way to do it. And some people are naturally able to figure it out better than others and have that. But that doesn't mean that school shouldn't be available to everyone or for everyone. And so I think a big part of our job is making sure that kids can get through school and that that's not a barrier to their success or their quality of life. Same with
Mhm.
family. So it's a ton of what we do. And my kids always love it when they come in and we're talking about school and they say, God, I hate school. And I said, I hated school too, but we figure it out. And that's what I'm here to help with.
Yeah, yeah, could not agree more.